Welcome back. Today our topic of discussion would be the anatomy and physiology of pharynx. In general, you should be knowing that pharynx is actually a conical fibromuscular tube and the extent is important. It is extending from the base of the skull till the lower border of the cricoid cartilage. And as we all know that in the GIT we have studied about four layers, which was the mucosa and the submucosa and the muscular layer as well as the serosa or adventitia. But in case of pharynx, you have to remember two particular things, the second point and the fourth point. From within outwards, the pharynx is having four layers. The innermost is the mucous membrane, as everyone knows. The pharyngeal aponeurosis, which is also known as the pharyngobasilar fascia, it is of importance, and then comes the muscular coat. In the muscular coat, you have to remember that there are two layers. One is the internal layer and one is the external layer. In the internal layer comes the stylopharyngeus, salpingopharyngeus, and the palatopharyngeus. And in the external layer is coming the constrictor layer. The superior constrictor, middle constrictor, and the inferior constrictor. Now one can confuse the internal with the external or the external with the internal. So you can remember with this concept that tongue is on the inside, right? Palate is on the inside. So palatopharyngeus, salpingopharyngeus, stylopharyngeus, all these muscles constitute the internal layer and the constrictor muscles are constituting the external layer. Then the fourth layer is the buccopharyngeal fascia, right? And the mucous membrane is ciliated columnar in the nasopharynx, only in the nasopharynx. Otherwise, it is stratified squamous elsewhere, right? And this is just a read. The pharyngeal aponeurosis is also known as the pharyngobasilar fascia. The muscular coat is described. The buccopharyngeal fascia is actually covering the outer surface of the constrictor muscles. The muscular coat from external aspect is covered by buccopharyngeal fascia, and from the internal aspect it is covered by the pharyngeal aponeurosis or the pharyngobasilar fascia, right? Moving on, this is an important thing that you have to remember, that this is the Killian's dehiscence. If you remember the anatomy, then you know that there is a muscle which is known as inferior constrictor muscle, which is actually the part of external layer of the pharynx, right? In which it is having two parts. Inferior constrictor itself is having two parts, the thyropharyngeus, which is actually diagonal, and the cricopharyngeus, which is having transverse fibers. And in between these two things, like if I draw this is the cricopharyngeus and this is the thyropharyngeus. So there is a space which is known as the Killian's dehiscence. It is of prime importance because it is a site of herniation in case of the pharyngeal pouch when it is formed in case of any sort of incoordination, either neurological or muscular incoordination, right? Voldier's ring. This is very important. You should be remembering the location of the Voldier's ring. It is actually subepithelial. It is not on epithelial aspect. It is beneath the epithelium. That is why it is a subepithelial layer, and it is aggregates of lymphoid tissue, in which there are a lot of things you have to remember. These are 6 points. The adenoids, they are also known as the nasopharyngeal tonsils, are present. The palatine tonsil, the lingual tonsil, the tubal tonsils, the lateral pharyngeal bands, and the nodules, right? Moving on to the pharyngeal spaces, you have to remember that these are the two important spaces. They're important because in any sort of spread of infection or any sort of metastasis or any sort of infection, we can determine the extent if we know these two particular spaces, right? The retropharyngeal space, as the name indicates, that it is behind the pharynx and it is extending from the base of the skull till the bifurcation of trachea. Now here you have to remember one thing, that pharynx is extending from the base of the skull till the lower border of the cricoid cartilage, but this particular space is extending further downward till the bifurcation of trachea. This is an important point. So if any pharyngeal infection is going till the level of trachea, you should be remembering that yes, this is possible because this particular space is extending till here, till the bifurcation of trachea. Moving on to the parapharyngeal space, as the word suggests, para means on the either sides. If this is the pharynx, this and this is the parapharyngeal space, right? The contents are important. It contains the carotid vessels, jugular vein, and the last four cranial nerves, and the cervical sympathetic chain. If you know the anatomy, that it would be easy to remember that you all know that in the neck which vessels are the major vessels. The carotid vessels as well as the jugular vein is important, and the cervical sympathetic chain, since it is the cervical area. All you have to mainly remember is the last four cranial nerves, right? Now you have to remember the division of pharynx. Pharynx is actually divided into three parts: the nasopharynx, oropharynx, hypopharynx. In this particular aspect, you have to remember the name and their extent. Nasopharynx extends from the base of the skull till the soft palate or the hard palate, and the oropharynx extends from the soft palate till the hyoid bone, and the hypopharynx extends from the hyoid bone till the lower border of the cricoid cartilage. Now, some important things in every part will be further discussed. Nasopharynx is also known as epipharynx. As I mentioned earlier, it is extending from the base of the skull till the soft palate. It is having these relations. If you have a ample knowledge about anatomy, you definitely know that the roof is formed by the basis sphenoid or the base of the skull. The posterior wall is formed by the atlas of the vertebra. And yes, this is important, that which vertebra is related with which part of pharynx. This is important that you should be remembering, that the pharynx in general extends from C1 till C6, right? So nasopharynx is related with the first vertebra, and the oropharynx is related with the second and the third, the upper part of the third vertebra, and the laryngopharynx is related with the third lower part till the sixth vertebra. This is something to remember, right? Roof is formed by the base of the skull, posterior wall is formed by the C1, floor is formed by the soft palate anteriorly, but it is deficient posteriorly because it is continuous with the oropharynx. The anterior wall is formed by the posterior nasal apertures, and the lateral wall. This is important. This fifth point is of prime importance clinically as well as examination point of view. That lateral wall in which the eustachian tube, which is actually the extending from the ear till the pharynx. So opening of eustachian tube lies in the nasopharynx, right? And on either sides of that opening is some sort of elevation, which is known as the tubal elevation, also known as the torus tuberous, right? On either sides of this torus tuberous is the fossa of Rosenmuller. This is the torus tuberous, and this is a recess behind it, a pocket, kind of a depression, which is known as the fossa of Rosenmuller. Why do we study it? Because it is a very common site of carcinomas, because whenever there is a depression, the secretion will accumulate, and if they are not removed from that particular area, it will lead to infection, further changes, and this is a common site for carcinomas, right? As it is mentioned that it is the commonest site for the origin of carcinoma. In this nasopharynx, you see adenoids, which is of prime importance in babies as well as in children's, because adenoids are prone to enlargement if they are infected, right? And they will then block the passage of respiration, as well as they will lead to problems and mouth breathing and further infection, which is not suitable, or we would say which is not beneficial or comfortable for that particular child, right? You understand what I'm trying to say. Then comes the nasopharyngeal bursa. In this particular aspect, you just have to remember that if there is an abscess in nasopharyngeal bursa, then a disease known as the thorn wall disease will occur. This is just an MCQ point, and further with the passage of time we will be discussing it. Here you just have to remember that nasopharyngeal bursa, if there is an abscess in it, you will be having the thorn wall disease. Rathke's pouch craniopharyngioma may arise from it, and the tubal tonsil. You have to remember that, as I mentioned earlier, that where the eustachian tube is opening, there is an elevation known as the torus tuberous, and this is actually the tubal elevation. And when it is enlarged, if this is the opening of the eustachian tube, on either side there is a little bit of tubal elevation, which is known as the tubal tonsil. If it is swelled, or we would say enlarged due to some infection, what will happen? The eustachian tube will get blocked and the symptoms will occur. Eustachian tube occlusion. Sinus of Morgagni. This is important. I told you about the Killian's dehiscence, which was present on the inferior aspect of the pharynx in the inferior constructor muscle, where the pharyngeal pouch can come if it is incoordinated, right? On the superior aspect of the pharynx, between the base of the skull and the upper free border of the superior constructor muscle. If you remember the anatomy, that base of the skull and the upper border of the superior constructor, there is a space which is known as sinus of Morgagni. Here you should remember the contents, but the most important from ENT aspect is that eustachian tube is entering from the sinus of Morgagni. This is important. The passavent's ridge is actually a mucosal ridge which is raised by the fibers of palatopharyngeus. This is an MCQ point, that which muscle is responsible for the formation of passavant's ridge. So this is the palatopharyngeus, P for passavant, P for palatopharyngeus. Epithelial lining, as I mentioned earlier, that the nasopharynx, only the nasopharynx is lined by the ciliated columnar epithelium. Otherwise there is the stratified epithelium, this one, stratified squamous elsewhere, right? Moving on to the lymphatic drainage, the respective and lymphatic drainage will be responsible for the nasopharynx, which is the upper deep cervical jugular nodes. Now comes the function of nasopharynx, in which you have to remember that this part of pharynx is responsible for air. There is no food related content here, right? So you have to remember that this is a passageway for air, and you remember that in the lateral wall of the nasopharynx is the opening of the eustachian tube. So it equalizes the air pressure and ventilates the middle ear, right? Elevation of soft palate is responsible and is having a role in the swallowing process, and it is acting as a resonant chamber. Obviously there is air, there is a resonation and the resonating chamber during voice production, and drainage channel for the mucus secreted by the nasal and the nasopharyngeal gland. The highlighted part is important. You should be remembering and you should be knowing that what is the function of nasopharynx. This was the first part of the pharynx. Moving on to the oropharynx, you have to remember that we have studied from the base of the skull till the soft palate is the nasopharynx. Now below it till the hyoid bone is the oropharynx. So from the plane of hard palate or soft palate till the hyoid bone, right? The boundaries, you have to remember, it is related posteriorly. As I mentioned here, it is related posteriorly to the second two and the upper part of the third vertebra. And then comes one important term which is known as valleculi, right? These are actually cup-shaped depressions lying between the base of the tongue and the anterior surface of epiglottis. As you can see, this is the tongue, right? These are the circumvallate papillae. This is the base of the tongue, and this is the anterior aspect of the epiglottis, and in between them there are some folds, glosso-epiglottic folds, median and lateral, and in between them there are the cup-shaped depressions known as the valleculi. Why do we study them? Because sometimes foreign body or the food, sometimes like the bones of fish, they are impacted here, and they can cause irritation and swelling and infection if not removed properly, right? Moving on to the lateral wall. Lateral wall of the oropharynx is related with the palatine tonsil, right? And it is having two pillars. One is the anterior pillar and one is the posterior pillar. You remember that if you remember that this is the mouth, right? This is the tongue. This arch that you are seeing is the palatoglossal arch. This is known as the anterior pillar. And posteriorly, this arch that you are seeing is the palatopharyngeal arch, right? And in between them, there is a triangular depression which is accommodating the tonsil, right? Tonsillar fossa is located in between the palatoglossal and the palatopharyngeal arch, right? The lymphatic drainage is the upper jugular chain. Moving on to the functions of oropharynx, you have to remember now here food is also passing as well as air is also passing, right? So it is a passageway for air as well as for food. It has a role in swallowing, and it forms a part of vocal tract because it is responsible for speech and sound, resonance, vibration, and taste appreciation because it is related with the base of tongue and soft palate and all these structures, and local defense and immunity because as you see that the tonsils are there and they are having a very important role in immunity. As I mentioned earlier, that this is actually in the end forming of the part of Waldeur's ring, which is actually the aggregates of lymphoid tissue. And what do the lymphoid tissue do? They are responsible for the immunity in any sort of harmful substance when it comes inside the oral cavity. Moving on to our third part of the pharynx, which is the hypopharynx, also known as the laryngopharynx. Why do we call it as laryngopharynx? Because it is having a relation with the larynx, right? So extent, as I mentioned earlier, this is important, from the body of hyoid bone till the lower border of the cricoid cartilage, and the posterior aspect is related with the lower part of the third vertebra and the sixth vertebra as it is written here. So this is the posterior aspect. Now up till now we have studied the pharynx in three parts: nasopharynx, oropharynx and the laryngopharynx. But the laryngopharynx is itself divided into three parts. One is the piriform sinus, this is important, the piriform fossa and the postcricoid region and the posterior pharyngeal wall. Now you have to remember that piriform fossa, the location of this particular fossa. If you can understand this diagram, this is actually a cut section, coronal cut section of the posterior, and you are looking the pharynx from the posterior aspect. You can see that this is actually the larynx. The inside cavity is the larynx, and this is the piriform fossa, right? And this is the post-cricoid region, and this the third part is the posterior pharyngeal wall. Why do we study the piriform fossa? It is also known as the smuggler's fossa, and clinically the internal laryngeal nerves run through this particular fossa. So this is an important relation that you have to remember while performing any type of surgery, any type of endoscopic invasion whatsoever. You have to remember that in the piriform fossa there is the relation of internal laryngeal nerve, right? So then comes the post-cricoid region, and this is present between the upper and lower border of the cricoid lamina. That is not important, but this is important, that in the post-cricoid region, it is the commonest site for Plummer-Vinson syndrome. It is actually a triad of three things. One is the anemia, esophageal webs, and one more thing which I can't remember at this particular moment. And then comes the posterior pharyngeal wall. These are the three parts. The prime importance of piriform sinus is internal laryngeal nerve. Prime importance of post-cricoid region is Plummer-Vinson syndrome. Piriform fossa. This particular piriform fossa is having a rich lymphatic network, and if there is any carcinoma in this particular area, there is a high frequency of nodal metastasis, right? If we talk about the functions of hypopharynx, you have to remember that this is a pathway for air as well as for food, and it is having a part in vocal tract, very important part in the resonance, and coordination and contraction of the pharyngeal muscle is very important in this particular area, because as I have told you earlier that there is a potential space which is known as the Killian's dehiscence, and which is formed in between the cricopharyngeus and the thyropharyngeus, and if there is incoordination of those muscles, what will happen? There will be a pouch, a diverticulum will form. This is known as hypopharyngeal diverticulum. Hope you understand, and this is it.